After the fires out, a study of post-wildland urban interface, fire contamination in public spaces, and potential risks to public health. In January 2025, one of the most devastating fires in California history began, causing mass evacuations from thousands of homes in the Pacific Palisades and Malibu communities. This was considered a unique opportunity to try and answer one of the most frequently asked questions from homeowners and neighbors who are deciding if or when to return and reoccupy their communities. Specifically, there are always concerns over what types of contaminants may remain in the dust and debris that has settled and covered everything, as well as infiltrated into every crack on a structure's exterior, which is precisely where the concern over the potential for human exposure and associated human health risks stem from. Approximately 7 weeks were spent in the evacuation zone from January 17, 2025 through February 21, 2025, and March 10, 2025 through March 17, 2025. This research was performed tangentially to ongoing professional smoke damage assessments utilizing my NIOSH fellowship and through partnerships with my company Hillman Consulting and the analytical labs performing the analyses, Eurofin Sacramento and Eurofin CEI. During this period, Hillman determined that all areas with heavy dust accumulation or infiltration within the impacted communities contained elevations of heavy metals, which should be explored further in conjunction with the above contaminants. Note that the 4 analytes on this slide were what this study focused on in consideration of the long-term combustion of large quantities of synthetic materials in the surrounding community. These 4 classes of contaminants are all considered to be likely human carcinogens and are considered emergent contaminants, so there is a high likelihood of establishing a greater potential for environmental or human toxicity in the future. Additionally, each of these contaminants is small enough to be embedded or entrained on or in a respirable particle and has the potential for passive diffusion directly into the bloodstream. 5 locations were identified, including 4 at areas throughout the Pacific Palisades, chosen as being representative of various levels of impact, elevation, location in relation to wind gusts, proximity to impacted structures, and/or type of materials present. The 5th location was chosen approximately 8 miles away from the sampling areas to be used as a control site. Sample collection was performed over the course of 2 days. After all samples were collected, bagged, and marked, then all samples were packed on ice, sealed in laboratory-provided coolers, and shipped overnight to the lab for sample processing and retention. All sample media and reagents were provided by the laboratory with instructions for sampling and return shipping. Each location had 2 samples collected for each contaminant, with samples collected from the same or similar surfaces and materials wherever possible and/or applicable. Samples were collected predominantly from metal signs or poles considered as prime materials and locations for deposition to occur. The analytical results identified combustion byproducts in all samples, including the control, indicating higher than expected background CBP levels, or that wildfire smoke plumes had much wider spread fields of impact than most people expected. These results generally consisted of char and ash with little soot detected, which is typical of wildland fires, although there is soot presence the closer to heavy widespread structural damage you are. Polynuclear aromatic hydrocarbon detection was limited to areas where samples were collected where fire suppression equipment had been used, such as foam or liquid fire extinguishers. Dioxins, furans, and polyfluorinated alkaline substances were identified in all samples, with general reductions in concentrations occurring the further from the heaviest impacted areas you travel. Levels for dioxins, furans, and PFAS were low and well below any current level of concern for human exposure. Due to the perceived level of toxicity, both pH and PFAS surface concentrations should be kept as low as possible, with no applicable standard available or reference for guidance. In consideration of our findings and sampling results, we were unable to verify with a statistically significant degree of certainty that residual surface contamination byproducts of incomplete combustion pose a moderate or high risk of negative human health impact. Since these contaminants are all emergent and all lack applicable standards or established guidance thresholds for hazardous levels of surface contamination, it is difficult to establish whether the observed low levels could have some chronic health risk without additional information. Many limitations were experienced and addressed during the course of this study. Primarily, this research and associated sample collection was rushed in order to meet timing deadlines. Furthermore, due to the unplanned nature of these types of losses and environmental impact, it is near impossible to effectively plan for this type of study. Additional timing spent designing the project would greatly reduce the potential for bias, as well as more likely to effectively address any potential study design shortcomings. In consideration of the continuation of this study, future direction should include a full risk assessment to statistically determine the toxic equivalency and significance of low concentrations of dioxin furans and PFAS. Additional sample sites should be considered, including a more tightly controlled background location, as well as indoor and outdoor sampling in the impacted areas, along with priority pollutant metals and particulate matter direct read screening for a full understanding of potential post-fire related exposures. Thank you.